Hey there, good morning class. Coming at you with one last video with some quick feedback on Forum 5. So this was back when we had talked about depression and aging adults. So I'm going to read the question here. Describe one evidence-based practice for age onset depression and one best practice for older adults living with severe mental illness. Furthermore, why should we make the distinction between age onset mental illness and non-age onset mental illness in the services we provide? So, I have to say, you guys did very well with this question. It's based practices for adults with depression. Many of you noted CBT, cognitive behavioral therapy, as well as behavioral therapy. Somebody talked about the problem-solving treatment, interpersonal psychotherapy. I believe Val described the reminiscence therapy, which I think is a kind of cool thing, and cognitive bibliotherapy. And then there were a few non-psychotherapy interventions, so, antidepressant meds, multidisciplinary geriatric mental health outreach, so a specifically tailored service to reach out to people that are living alone, I would imagine, a multidisciplinary team approach. And then we have collaborative and integrative mental health and physical health care. So many of you guys talked about the psychotherapy interventions, and that's fine because those are the ones that were discussed prominently in the lecture. And then when we look at the best practices for people, for older adults in general, a lot of you guys nailed the HOPES intervention. So it's the integration of health promotion and psych rehab. And some others described cognitive remediation and also noted cognitive behavioral therapy listed here as a best practice for older adults in general. Cognitive behavioral focused social skills training, and illness management and recovery. So those were some of the best practices that people highlighted for the second part of the question. And then the third part, why it's important to make the distinction between age onset and non-age onset, really came down to the fact that there's going to be different treatments that are best suited for whichever one you happen to be working with. So you want to get a proper diagnosis there in order to be able to prescribe the best treatment. As well as, so you have all of these interventions, you would want to be able to kind of narrow it down, and that would be one way you could do it, is by kind of classifying it as age onset or non-age onset. And then if it is age onset and it is happening later, what that becomes is more of an early intervention type of case. And the research really across many disciplines has been in favor of early intervention. And that makes sense, I would think, to many of us. If we know that something is going to potentially be a problem down the road, if we intervene early, we have a better chance of either minimizing the disruption or possibly even eliminating it altogether. So a couple of people brought that up as well. So overall, good job. Going to drop in the grades now, and Dr. Spagnola should be along either today or by the end of the week with grades for Group 3. Take care.